Hi, I'm Jennifer. I'm a nurse. I'm an LPN at Community Care. It's a home health care agency based on the newsstand. I've been with the company for 13 years, since 2007, since I completed my nursing diploma. This is Wyatt. This is my client. He's having lunch right now. Yeah, I had a family member who worked for Community Care, and they told me about the company. So fresh out of nursing school, I waited to take my boards, and then I applied, and I got the job. And Community Care is very flexible with their schedule, with the home care. They had a lot of clients that was close to my home. If I would have to leave early, I could, or if I could come back and finish out my shift, or reschedule a whole different day of work, I could do that and make up the hours for myself and my family that I was attending to. I've learned a lot of skills working at Community Care. Right out of school, I learned how to use a trach, a ventilator machine, a suction machine. I learned how to do female and male catheters. I learned how to give breathing treatments. A whole lot of stuff that I didn't expect to do in home health. A lot of people have a different idea what home health is about, but you actually do a lot of hands-on work besides the feeding, the bathing, running errands. You do a lot of medical things. You give out medication orally through G-tubes. I learned about G-tubes through Community Care. The trachs, doing the suctioning, changing the trach. On infants, adults, it's very tricky in infants, little kids, because they move around a lot. You're supposed to use, two people to do it. And a lot of times you don't have a second person to help you. It gets a little tricky. You have to reorder medications, make sure the information is correct, their personal information, their dates, the times, the amounts, because there could be some miscommunication if there's more than one nurse working that case. You have to fill out a medication MAR every month and renew it. Make sure you have the up-to-date medicine on there. Take off medication that they're no longer receiving. You have to communicate back and forth with your supervisor, your RN supervisor in the office and the doctor's office to make sure that all the medications are correct and how you're giving them is correct. But traveling with your patients, you could take them to different doctor's appointments. It could be for speech, it could be for occupational therapy, it could be just a regular checkup, a medication check. You take them out for socialization. They need to interact. A lot of people, just because they have medical conditions, are always in the house, but sometimes they need to be out to socialize, to interact with other people, to see what's really going on besides what's happening in their house, and it brightens their day. Not everybody wants to be in the house all the time when they think they're just having medical attention. They want to be out in society and see what everybody else is doing, maybe sniff the roses, so to say. I do a lot of that. Like I said before, most of the things I like about Community Care and home care is the flexibility. If I get an emergency phone call, I can talk on the phone and see what's happening with my family if there's an emergency. I could leave the shift and come back if I had to. Most of the time when you work in a facility, you can't leave your shift. Sometimes in home care, you can't leave your shift. If you're the only one working there, you have to call and make sure there's someone else to be there with your client. But most of the time, you're able to take them out of the home. But you have a lot of equipment you have to take with you. You have to make sure you have their medications, their travel bags. Working for Community Care and home care is different from working in the facility. In the facility, you have to stay your whole entire shift. If there's an emergency, you can't leave. You really can't be on your phone. Sometimes you're mandated to work over, and you really can't because you have to find other babysitters for your kids if you have kids at home, and different things you need done at your own home. Whereas working in home care, it's a lot more flexible. You can, while you're doing errands for your client, you can possibly do some of your errands. You could talk on the phone as long as you're not on the phone the whole entire shift. You can take a quick, important phone call and get back to, whatever you need to get back to. Or like I said, if you needed to leave, just make sure there's someone here with your client and you could go and handle something that's important, if you needed to, and you're not reprimanded for it. They understand that you have a life as well besides the facility where people live there 24/7 and they need 24/7 care, so you really can't just leave the shift and come back or go and do something. You have to stay there, and you're mandated to stay over sometimes if there's no one to cover the next shift. Whereas in home care, there's usually someone there for you. You know, if you have to leave, or if there's the next shift, there's usually someone who comes in, or the family comes home. And that's one of the big pluses of home care. So if you're interested in working for community care and home health, you could be an RN, LPN, CNA, home health aide, direct care worker. Just check out the information below after this segment and give us a call.